Good morning to all. So today's topic is histology of maxillary sinus. Contents include introduction, paranasal sinuses, functions of maxillary sinus, histology of maxillary sinus, and maxillary sinus mucosal layers. So what are paranasal sinuses? So paranasal sinuses are air-containing bony spaces present around the nasal cavity, and they are developed mainly from cranial and facial bones. So these spaces communicates with nasal airway and forms various boundaries of nasal cavity and are named for bones in which they are located. And they are usually lined by respiratory type of mucous membrane. So mainly pseudostratified ciliary columnar epithelium. So there are four pairs of paranasal sinuses which are bilaterally present: maxillary sinuses, frontal air sinuses, ethmoid layer sinuses, and sphenoid layer sinuses are present. So our point of interest, maxillary sinus. So maxillary sinus is a pneumatic space lodged inside the body of maxilla and that communicates with the environment by way of middle nasal meatus and nasal vestibule. And maxillary sinus is also known as antrum of Highmore. So middle nasal meatus will be having another important thing, that is the opening of maxillary sinus. So it is also known as ostium. So coming to the discovery of maxillary sinus. So maxillary sinus was first described and illustrated by Leonardo da Vinci. So earliest attribution of significance was given by Nathaniel Highmore. So Nathaniel Highmore was a British surgeon and anatomist, and he described maxillary sinus in detail in 1651. So maxillary sinus is also known as antrum of Highmore after him. So moving on to functions of maxillary sinus. So maxillary sinus executes different functions like imparts resonance to voice, increases surface area and lightens the skull, moistens and warms inspired air, filters the debris from inspired air, mucus production and storage, limit extent of facial injury from trauma, provides thermal insulation to important tissues, and serves as accessory olfactory organs. In detail on each function, conditioning of inspired air. Warming up of the inspired air is possible because of the rich arterial supply, and it helps to maintain an even and tolerable temperature. Humidification of the inspired air is achieved, and the possibility of irritation to the respiratory mucosa by dry air is prevented. Reduction of weight of facial skeleton. Maxillary sinus lightens the weight of the skull as it is filled with air. So it also increases the craniofacial resistance to trauma. Phonetic resonance and auditory feedback. The maxillary sinus may act as a resonating box for the voice, and sinuses also affect the conductance of voice to one's own ear, and it increases the area for olfaction. Production of lysozymes, which has bactericidal properties. One of the main functions, that is filtration. So because of the presence of mucous blanket and cilia, the maxillary sinus mechanically trap the microorganisms and dust particles present in inspired air and helps in filtration of inspired air. And insulation. The temperature of inspired air can vary. So the maxillary sinus may insulate the orbit from intranasal temperature variations. The growth and development of facial skeleton. Expansion of sinuses, particularly maxillary sinus, helps in rapid growth of facial skeleton. Just some points on anatomy of maxillary sinus. So among all the paranasal sinuses, maxillary sinus is the largest one, and it communicates with other sinus through the lateral nasal walls. And the teeth in close proximity includes canines, first and second premolars, first, second, and third molars. So this close relationship between the teeth and maxillary sinus can facilitate spread of pathology from tooth to maxillary sinus and vice versa. and the floor of sinus is just 1 to 1.2 centimeter below the nasal floor. And the shape of maxillary sinus is like a quadrangular pyramid. So it includes a base, apex, and four sides. And the four sides are superior, inferior, anterior, and posterior. As already said, the opening of maxillary sinus is known as ostium. So it consists of natural ostium along the medial wall, and it opens in the medial meatus at the lower part of hiatus semilunaris, and it is located post half of infundibulum or behind lower one third of uncinate process, and the average size or the dimension of ostium ranges from 2 to 4 millimeters. And sometimes maxillary sinus will be also having some accessory ostiums or accessory openings around this natural ostium itself. So coming to our main topic, that is microscopic features or the histology of maxillary sinus. So it consists mainly of three layers, that is epithelium, basal lamina, and subepithelium. First of all, epithelium. So epithelium is composed of pseudostratified ciliated columnar epithelium, which is derived from olfactory epithelium of middle nasal meatus. So various cell types that can be seen in the epithelium includes columnar ciliated epithelium, as already mentioned, which contains approximately 50 to 200 cilia per cells. So basically four types of cells can be seen in the epithelium. First of all, it is the columnar ciliated cells, and next one is the basal cells, which functions like stem cells that can differentiate into various other type of cells. It also consists of columnar non-ciliated type of cells. So ciliated cells were the first one. Now it consists of non-ciliated cells too, which comprise apical aspect of cell membrane and which contains microvilli and thereby increasing the surface area. And the last type or the fourth type of cells, they are the goblet cells. So mucus producing flask shaped secretory goblet cells can be seen, which produce glycoproteins which are responsible for viscosity and elasticity of the mucus produced. Then coming to ciliated epithelium, so 100 motile and immotile microvilli are present along apical surface. So the function includes mucus clearance along with entrapped debris from nose and all the paranasal sinuses. And the cilia beat together to form a metachronous wave. And the basal bodies of the ciliated epithelium serves as attachment apparatus of the ciliary microtubules to cell, which are the characteristic of apical segment of the cell. And the cilia is typically composed of 9 plus 1 pairs of microtubules, which provide motile apparatus to sinus epithelium. The microvilli are hair-like projections of actin filaments, and the length can vary between 1 to 2 millimeters. And the function of microvilli is increase the surface area of the cell and also prevent drying of the surface. So how the mucosa is cleared from maxillary sinus? So the mucus produced is around 1 liter of mucus in a day, and the mucus of maxillary sinus is mainly produced by serous and goblet cells. So sinonasal epithelium is covered by mucosal blanket, and the blanket of mucus is propelled towards ostium, that is a natural opening, by beating motion of ciliated lining cells. So the mucous material of sinus has two layers. So the first layer, that is top mucoid layer, which is sticky and collects bacteria and other debris, and also has bottom serous layer, which is thin and acts as a lubricant. So cilia of columnar epithelium will be beating towards the ostium at 15 cycles per minute, that is a metachronous wave with stiff stroke through serous layer reaching mucoid layer. So this mechanism slowly propels mucoid layer towards ostium and into middle meatus of the nose. So in this histology diagram, you will be able to identify all the type of cells, that is pseudostratified ciliated columnar epithelium can be seen, and also goblet cells, that is flask shaped cells. So they produce mainly the mucus secretions, and also minor salivary glands can be seen in the connective tissue. So the pseudostratified columnar epithelium cells will be having around 50 to 200 cilia per cell that beat towards the ostium to help clear mucus, that is 1 liter of mucus produced by these goblets and mucous glands each day from the sinus. And the mucus, as already said, will be consisting of two type of layers, that is the bottom serous layer and the top mucoid layer. And the cilia will be beating with a stiff stroke in the mucoid layer towards the ostium and a relaxed recovery stroke within the serous layer. So this way the mucus that is produced within the maxillary sinus is cleared from the sinus. So thank you all.